Major funding for these broadcasts is made possible by grants from Chase Commercial Term Lending and New York Community Bank, M&T Bank, Perfect Building Maintenance, Capital One Bank, the Witkoff Group, Greenberg Traurig, Genova Burns. Additional funding is provided by grants from AKA Hotels, Corman Communities, Aerial Property Advisors, AVR Realty Company, Bank of America, Merrill Lynch, Bank Leumi USA, Briarwood Organization, CBRE, Citizens Bank, Colliers International NYC, CPEX Real Estate Services, Cushman & Wakefield, Customers Bank, DDG, Dime Savings Bank of Williamsburg, Fisher Brothers, First Nationwide Title Agency, Flushing Bank, Foley & Lardner, Friedman, Handler Real Estate Organization, HAP Investment Developers, Investors Bank, James D. Kuhn Real Estate Institute at Syracuse University, James Orphanides, Chairman USRealty.com, Kilroy Architectural Windows, New York's Window Company, Madison Realty Capital, Massey-Knackle Realty Services, Matone Group, Mercantile Commerce Bank, N.A., Meridian Capital Group, Newmark Grubb Knight Frank, New Banks, MHP Real Estate Services, Optimum Window Manufacturing Corp., People's United Bank, Rosewood Realty Group, SJP Properties, Sterling National Bank, Sterling Risk, Stonehenge Partners, TD Bank, Terra CRG, the Continuum Company, the CUNY TV Foundation, the Moynihan Group, and these friends.
Montana, La Paz, Chicago, South Bend. You know, growing up all over the country. You know, then Notre Dame, medical school, Mayo Clinic, Chicago, Reese Hospital, then U.S. Healthcare, Empire Blue Cross.
Well, we got around.
I got around. I got the legendary Dr. Michael Stocker. Thanks for being here.
How are you?
So tell me about the Stocker family. They came over many, many years ago. How many years ago did the Stockers come over?
Yeah. So there were kind of, I guess, fall into the category of Pennsylvania Dutch. So they immigrated from where Switzerland and France and Germany comes together.
In like the early 1700s?
1732.
1732.
Right. And their way was paid over by the English because they wanted farmers who would settle and who weren't Catholic, which of course is ironic because we are.
Because
Catholic.
then they converted to Catholicism, right?
Yeah, right. But they wanted them as a bulwark against the French.
Now, the Stockertown is still in Pennsylvania, right?
It's still there.
Now, how does the family then get to the next place, Montana, or?
Well, they moved around a lot. Remember, that's a long time ago. So there's a little town called Stockertown near Easton, Pennsylvania. And then part of the family moved to Ohio, and then my great-grandfather had 16 kids by two mothers, and they fell on hard times, and when he was 16, my grandfather moved to Montana.
And that's the picture that we have over there of your grandfather and grandmother?
Yes.
So that was taken in what year? When do you think that was?
There's no date on it, but I think they're wedding pictures, so that would be around 1910.
And then we have a picture of your grandmother with a rifle?
Yes.
And what did they do in Montana?
They were first farmers, and then he was the secretary-treasurer of the Mill and Smeltermen's Union in Butte, Montana. So it was the local, the people that refined the ore, not the miners. That was a different union. And they started dry land farms twice and went broke both times. And then he went back and was successful at farming right around Sand Coulee and Stockett, south of Great Falls.
So that's one side of the family. Tell me about the other side of the family.
Yeah, there's a little less known about the other side of the family. They were German also, Mies. And my grandmother, my maternal grandmother, died at birth. So when my mother was born, so I never knew her. And my grandfather, Henry, he remarried, and we didn't really see them very much.
How'd your mother and father meet?
My mother and father met in high school in Butte, Montana, where my grandfather worked in the smelter.
Right, but what about the other side? Your grandmother is.
They were in either Butte or Great Falls, Montana, back and forth. It was a lot of moving around then for jobs.
Now, your father, how'd he became an engineer?
Right, he went to Montana School of Mines, which is in Butte, Montana.
So he was going to be mining for gold and other?
Well, you know, it's a big mining town. Copper was what they mined.
Copper and magnesium and other.
Right, yeah. So it was kind of a natural, you know, that his father worked in the smelter and was a union official, and so it was kind of natural that he'd go to college there. And after college, he actually moved to New York and trained for a year, worked for Ingersoll Rand, married my mother. They had met in high school, and moved to Bolivia.
Now, this is during the war.
Actually, before the war, 1937.
1937, they moved to Bolivia.
Right.
Because your father passed on at the age of 34 in 1944.
Right.
So they were living in La Paz. Now, you said to me that you were born in Minneapolis,
right?
Even though your mother wanted you to be born in America.
Right.
So you were born in Minneapolis and then went back to La Paz.
Right.
And your father was doing engineering in La Paz?
He sold mining equipment in Oruro, which is the center of the tin mines in Bolivia. He worked for Ingersoll Rand and sold drills and compressors and stuff.
So he passes on, your mother moves back to Montana?
She moved to San Francisco, and I moved back to my father's parents, first to Kalispell, Montana. And so my first memories, when I was like 3 years old, was growing up there. He previously had been in the stockyards. He'd run the stockyards in Great Falls, but when I got there, he kind of retired, and we moved to a little farm outside of Kalispell.
So, growing up, a kid on a farm?
Yeah.
Milking cows?
Yes, I milked cows. And took care of the chickens and, you know, cut wood for the wood stove, and it was a nice life. You could live almost for free.
And then later on in life, you moved back with your mother, right? And then
right. So the family, she moved from San Francisco to Spokane, Washington, which is in eastern Washington. And my grandfather moved to a little town called Opportunity, Washington, which is close to Spokane, Washington. And he did the same thing there. He got a farm. And I split my time between him and my grandmother and my mother.
And your mother got married to the guy, he was a petty officer in the military.
Right. Fred Nitschke.
And
good guy.
And then you lived later on in life on the military base.
Yes, he was on the local military base in Spokane, a Naval Air Station, and it closed, and so we then moved to Glenview Naval Air Station, which was in a suburb of Chicago, the northern suburbs of Chicago.
So here's the kid who grew up farming, moving a number of places. You're now in Glenville, Ohio, right?
No,
Illinois.
Glenville,
Illinois. How do you decide that you want to become, because you're an internist, family practitioner originally, how do you decide that you wanted to go to Notre Dame?
Well,
I mean, there was not that fighting Irish background over there, you know.
I went to a Loyola Academy, which was a Jesuit high school when I was in Chicago. I went to Gonzaga when I was in Spokane, and honestly, I think a quarter of my class went to Notre Dame. It was kind of the place that you go. I really enjoyed it. It was a great experience.
So what happened to engineering? I mean, you were going to be an engineer.
I was.
What possessed you to study medical?
I was an engineer for actually the first 2.5 years of college. I was a chemical engineer. I was sitting next to a pre-med student who was taking a numbers theory course, and he said, I got to get an A. I got to get an A in this. This is my hardest course. I remember thinking, this is my easiest course. And this guy's going to make a lot more money and do a lot more interesting things. And I dropped it, and I went into pre-med and then went to medical school.
You said to me, since you were engineering and then you were pre-med, it was a little difficult to get into the medical school. So what happened? How do you get to Marquette?
You know, I worked hard. I don't know. I was a nerd. You know, I don't know what else to say. It's mostly about getting good grades and working hard.
So you
And I liked medicine. I was never super at the science years, but when I interacted with people, I really enjoyed that a lot. And I enjoyed it. I still do.
now Marquette was at that time was Marquette Medical School, which
Yep.
changed its name today to
Medical College of Wisconsin.
Medical College of Wisconsin. And while you're at the Medical College of Wisconsin, you begin your residency where?
So I did a year of internship at Milwaukee County General Hospital, and then I did 3 years of internal medicine at the Mayo Clinic.
Now, in between, what about the military?
So everybody was drafted. I graduated from medical school in '68. They drafted the whole class in the country. I went, after I did my internal medicine training, I spent 2 years in the Army.
So how was Rochester, Minnesota, training at the Mayo Clinic?
Cold.
Besides cold.
Very, very well organized.
Well suited for the temperatures that we're having in New York today.
Yes, very well organized. Everybody was employed by Mayo Clinic, and they weren't little doctors in private practices with 3 or 4, people. It was one big organization.
But this was a time when the solo practitioner was a different time. Mayo was like Kaiser. Kaiser was created,
Right.
specifically for the Kaiser boat, the aluminum and the boat company, because they wanted to take care of their employees. Mayo was taking care of a community, and they had a model. They had a procedural model. Now, you like people, which was the Mayo concept of full care. So you're at Mayo. How do you decide that you wanted to be an internist, family practitioner?
I liked the interaction with people. I think I knew I was never going to be a great surgeon. I really liked the interaction. And I liked the model that's integrated. Everybody's working for the same goal. There's a story about the beginning of the Mayo Clinic. So the brothers Mayos and the father were originally just getting fee-for-service money, and there was 7 doctors there. And they all decided they were going to go on salary and plow the profits back into the clinic and expand. 2 of the doctors left, the others stayed, and that's the story.
So you're at Mayo Clinic. How do you then decide to go to Chicago, back to Chicago?
So I got more politically active. It was the time. I actually went to San Joaquin General Hospital.
You were there for what?
A year and a quarter.
Now, but this was the time of socialized medicine. I think part of it related to Montefiore, where you're on the board today. Montefiore probably in the 60s was a leader in social medicine. They had the residency program in social medicine. Victor Seidel was there. Spike, this was before Spike.
Yep.
What was his name?
Martin Cherkasky.
Right. And he, this was an institution that they really created today some of the finest healthcare leaders, Joe Bufford and other people like that, who were more social medicine.
Yep.
Well, what is social medicine in your mind?
It's the ability to take a community and all the things related to healthcare, food, housing, and actual healthcare, and integrate them together so they're integrated so people have access to all the things they need that's important for their health, not just medicines and emergency rooms and stuff like that.
And they were the precursor of running these medical clinics also.
Yes.
The community, they had the Martin Luther King MLK Health Center.
Right.
That they were out there in the ghettos and in neighborhoods, in the rural neighborhoods.
Both. Yeah, they're called FQHCs, Federally Qualified Health Centers.
Right, that did not have enough medical care, that at one time had the wrong type of medical care because the doctors who were in those communities were really, as we would say, the Medicaid clinics as opposed to taking full care of services.
There was some of that, yes.
Now, so you could then go to Chicago and you get involved with the Association of Interns and Residents, right?
Yeah, we called it the National House Staff Association, and we were going to fix everything. So these are people in residency training. And actually what we ended up doing really is making sure we got more pay.
More pay for more hours.
For the doctors.
Right,
yeah.
because
I mean,
it was also...
It was terrible.
Now, it's the 70s, and it's a time that there's, we had Kaiser, but Kaiser was, like Mayo, a practice,
Right.
they owned their own hospitals, they owned their own facilities, and people worked for the institution. And there was this idea of the health maintenance organization, where if you take care of the patient and if you're part of a panel, you would be involved. How the kid who grew up everywhere around the country and who at this time spent a lot of time in the Midwest, with Notre Dame and Milwaukee and Chicago, venture to the Big Apple?
So I liked people. I mean, I liked the process of working together. Like I would always run for office in the various house staff associations. I worked 5 years in family practice at Cook County Hospital, and I liked the territory a lot. I liked the idea of a public hospital.
Right. Now, Cook County was a large public hospital, the largest
Still
probably
is, at the time, yeah.
at that time, which relates well to your later on in your career in public hospitals. So what was the opportunity in New York?
So I really always wanted to come to New York. I can't really explain it. Nobody in my family understands it, and I can hardly get them to come and visit. I'm just one of those people that always wanted to go there. I was going to do it for residency, and my wife refused. She wasn't going to move there. I tried. I made it on the third time, but I always wanted to come to New York. I think.
So when did you come to New York? In what, 80?
85.
In 1985, and you joined this fledgling company that was created, in like 82?
Yes.
1982, a company which was based in Horsham, Pennsylvania, I think.
Yeah,
A company at that time called U.S. Healthcare, right?
Right.
Who was basically a new insurance company, really geared to a health maintenance organization.
Right.
And what do you join the company as?
I was the medical director for the New York market. I moved to New York, even though they were in Pennsylvania. I thought this was a concept that was going to work. The HMO Act, which did startup funds, was passed in 1973, and it took, the government created an industry and funded part of it. And it took 10 years for it really to take effect, but it was just a better way of practicing medicine. There's a lot of things have done things to other things since then, but in fact, it was a better proposition than what we currently had back then, the traditional fee-for-service system, and you just kind of put together yourself, your doctors and your hospitals and so on.
But there were the contracts with the hospitals.
Yes.
As opposed to owning the hospitals. Yes. The doctors were also independent doctors. They were just getting paid per membership. And they effectively, in today's healthcare system, the idea was to keep people healthy so they wouldn't see them that much.
In a sense, the Affordable Care Act, Obamacare, is kind of an extension of the HMO Act of 73. It's the same impulse, which is to have a coordinated and economic system of healthcare. And it's been a long pathway, but we're getting closer.
So you're at U.S. Healthcare originally as the medical director, and then you're the the executive director of the New York area. And at that time, U.S. Healthcare was growing, and they grew by leaps and bounds.
Yeah.
And then what happens? You decide to join Cigna?
I was ambitious, and I was recruited by Cigna to be president of their health plans. And it was a job I'd been at U.S. Healthcare for 8 years. I wasn't going to go any further in the company.
This is before they sold to Oxford.
Aetna.
To Aetna, right?
Aetna,
Originally
right.
Aetna.
Yeah. And I knew I knew eventually the president, Leonard Abramson, was going to sell them, and I didn't really want to be around for that. So I went to Cigna. And
now, which was based in headquartered in Philadelphia.
Well, the medical part was in Hartford.
Hartford and
I
Philadelphia,
moved to Hartford to Connecticut, yeah. And I did that for a couple of years, and then I got recruited to go to Empire Blue Cross.
Yeah, let's talk about Empire, because you joined Empire at what, 96?
94.
94, And Empire, which is the Blues, the Blue Cross and the Blue Shield healthcare system, the largest in the nation at that time and still one of the largest healthcare, was, as one would say, in the proverbial crapper, hemorrhaging money. Not losing money, but hemorrhaging money.
Yeah.
And this was a challenge, okay? Even a challenge for the socialized, because the social medicine. How do you get involved with an institution that literally was in the low life of their time? How do you and the administration and everybody decide that we're going to take a nonprofit institution who used to get their rates by the state of whatever the state would be nice to you,
right,
to change it to become a for-profit?
So that's a lot of territory there, but I knew I could fix it. By then, I'd been around enough to kind of know what was possible.
So how do you fix it?
Well, I mean, you run it well. Second, it was kind of an arm of the state the way it was run. And although the state could be very helpful, they also made it impossible to expand and acquire other companies. At the time, there was a big wave of aggregation of companies and health insurance companies. And scale for insurance companies is very important. Not so much for doctors and hospitals, but scale is very important for insurance companies. And I honestly believed if they were left on their own, that they would be able to thrive. It's got a great, Blue Cross and Blue Shield is a great branded name. They're in one service area. They had scale in that area. They had about 25% market share. It had, fair to say, not to be overly critical, had been run poorly. And I just knew that I could fix it. And the reason for converting to the for-profit company was, first, there's a lot less regulations if you're a for-profit company. At the time in New York, if you
pay taxes also if you're a for-profit.
Yeah, presumably.
But you never paid taxes before as a nonprofit.
No.
Because you never had a profit.
Yeah, right. Or you never showed a profit.
Right.
That would be a big mistake in those times. The state kind of had this attitude, this is then, that if you're not for profit, you're going to do what we tell you to do, but we'll take care of you, get in trouble. And if you're for profit, you're on your own. And don't come to us for help for anything. And honestly, that is a better way for a business to survive on your own.
But in order to do this, you needed the administration.
Yes.
Okay, the state administration. You had Pataki,
right,
who was, in favor of this type of program.
Right.
Because if you had a governor or a legislation who was against it, you could have had the greatest ideas, but nothing would have happened over there.
Exactly. And it required legislation. It required taking all the proceeds of the public offering and turning it over to a public asset benefit fund. And the state then sold it down over a period of time and benefited from the sale of the stock. It was a very weird transaction.
Now, when did you and the officers decide that you didn't want to remain as Empire, the for-profit, to be part of a larger organization, being at WellPoint?
So we had, after we converted, we had made a run at trying to acquire Oxford, and we didn't get them. And United did, which was about 10 times our size at the time. And so we knew we were going to get...
Why was it important strategically to acquire Oxford or acquire someone else?
Scale. You got to get to a certain scale to compete. I mean, at the time, United was 10 times our size. That means that they can bid for, we had the city account and the state account. United bid on it every year. They could bid less than we were because they were so big.
So how much of the business was the city and the state?
Each was around 900,000 members.
A percentage of the company, how much of the total revenue would you say?
It's probably 25% of the company. It was self-insured, so the revenue was not large.
It was the administration.
Right, they insured themselves. They were big enough to do that. Anyway, once we knew that we were going to get acquired. And you have shareholders, and shareholders like acquisitions because you get acquired at a premium.
Right, because you were a public company now.
Right, yeah. And our stock price tripled in the time from the public offering, about 4 years, to the sale of the company. investors did really well. The state did very well because they monetized all the stock.
You sell the company, you stay on, and then you decide that you need another challenge. So, and since you had been with Cook County, and at this time you were also on the board of Montefiore
Right.
and Einstein,
Yeah.
you get a phone call one day and they say, kid, public hospitals, largest public hospital system in the country, 17 hospitals, you want to be chairman? So what happens on that?
So actually, my friend and I guess mentor, Ira Milstein, I talked to him. And he talked to the mayor, and then the rest is, so I took the job. I was 65 then, it was kind of like a natural time to retire. And it was like being back at Cook County Hospital again. I really enjoyed it.
So this is a non-paid job. I mean, you have a car, but you are the chairman of the Health and Hospital,
Right.
which is 17 hospitals,
It's 11, really.
11 hospitals. How many employees?
38,000.
How many beds?
Yeah, it depends on how you count, but 7,000 roughly.
Right, and basically taking care of the city of New York, a large number of that. And you have that until the change of the administration and
Right.
over there. And over the years, you also have been involved with the United Hospital Fund, which you were honored last year. But you've also been involved with some VC and some public companies.
Yes. I have 4 little companies that I've invested in.
Now, what type of companies are they?
These are startups. They tend to be healthcare applications that tries to redesign care for individual patients.
So let's talk about family. You're married, and your wife is also involved in healthcare, right?
Yes. So I'm married to Patricia Wong, God bless her, and she's president of Health First, which is this $7 billion a year Medicaid and Medicare HMO was started by and run by voluntary hospitals in New York. Not all of them, but most of them.
Right, which comes back to your HMO roots, right?
Right.
And then you have a son, Luke.
I have a 16-year-old son, Luke. He's a junior at Stuyvesant, and my wife's wonderful son, Isaac, who is brilliant and 26 years old.
And then we have some other pictures of some other children. Tell me about your other children.
So John Stocker lives in Verona, New Jersey. He's in his early 40s. And his wife, Beryl, wonderful person. And he has 4 kids, wonderful, wonderful grandchildren. So there's Isabel, who just started high school, and Jack, who's 12, and Riley and Gus.
Okay, and then you have a daughter.
I do. She lives in Bay Ridge, Brooklyn. She's married to Marcus Marino. She has 2 children, Aubrey and Matthew.
What are you going to do when you get older? What do you want to do? You want to practice medicine?
I actually thought about that, but I'm almost 73. Next month I'll be 73. I don't think so. I think that's probably not a good idea for me or the patients.
So I'd say, for the kid who thought he was going to become an engineer and, then decided to be a family practitioner who spent time in the military and who's had a unique career, I'd like to thank you for being here today.
Oh, Michael, it's great. I really enjoyed it.